Welcome back, everyone. Today we're going to talk about Chapter 5 of Exploring Medical Language, the respiratory system. The respiratory system is in charge of two major tasks, external respiration and internal respiration. External respiration is the exchange of oxygen and carbon dioxide that occurs in the lungs, so between the body and the outside environment. Internal respiration is the exchange of carbon dioxide and oxygen in the body tissues, so between the blood and the tissues. So that's the difference between external respiration between the body and the atmosphere, internal respiration between the blood and the cells. So in order to exchange oxygen and carbon dioxide, we inhale and exhale. Inhalation is also called inspiration, to inspire, and exhalation is also called expiration. So inhalation, breathing in, exhalation, breathing out. Oxygen, the combining form is oxy, and carbon dioxide, the combining form is capno. The respiratory system has multiple parts, including the upper respiratory system and the lower respiratory system. So this chart is showing you the airflow between all of the different pieces of the system. So when you inhale, air containing oxygen enters the nose and mouth, moves down through the pharynx, then through the larynx, through the trachea, through the bronchial tree, and into the alveoli. The alveoli is where gas exchange actually takes place. So the oxygen enters the blood, carbon dioxide leaves the blood, and then the carbon dioxide is exhaled through the bronchial tree, the trachea, the larynx, the pharynx, and the nose or mouth. Nose breathing is preferred, as inhaling through the nose is going to warm and humidify the air before it gets to your lungs, which is protective for those very delicate lung surfaces. And this, everything we're talking about here, is external respiration. So let's look at some of the combining forms for the structures that we just learned about. The nose is naso, as you might expect, but also rhino. The pharynx is pharyngo. The larynx is laryngo. The trachea is tracheo. And the bronchus, which the plural of which is bronchi, would either be broncho or bronchio. The thorax, meaning the thoracic cavity, which contains the lungs as well as the heart and the thymus, is thoraco. The lungs individually are pneumo, pneumono, and pulmono. The pleura, which is the lining around the lungs, is pleuro. The mediastinum, which is the center cavity between the two lungs that contains the pericardial cavity, as well as the great vessels and the thymus, is mediastino. And then the diaphragm is diaphragmato. You'll see some of these combining forms when we're building terms in the respiratory system. So capno, if you remember, is carbon dioxide containing. Hemo, we've seen in previous chapters, means blood or bloody. Myco has to do with fungus or fungal growth. Phono is new. That has to do with the making of sound. And spiro is also new, and that has to do with breathing. This illustration is showing you the difference between the upper respiratory system and the lower respiratory system. The upper respiratory system includes the nasal cavity, the pharynx, and the larynx, and the lower respiratory system includes the trachea, the bronchi. These purple structures are the bronchial trees, and then all of this is lung tissue, and the alveoli are the small little sacs where gas exchange actually takes place. Some of the diseases that you'll see in the upper respiratory system are the common cold, rhinitis, which is a runny nose or inflammation of the nose, sinusitis, inflammation of the sinuses, tonsillitis, inflammation of the tonsils, pharyngitis and laryngitis, inflammation of the pharynx and or the larynx. And then the lower respiratory tract, you can see tracheitis, inflammation of the trachea, bronchitis, bronchiolitis, and pneumonia. So bronchitis and bronchiolitis, the bronchi are larger, these sort of large structures, and the bronchioles are these smaller structures in purple here. So it's just an inflammation of a different part of the lung. And then pneumonia would be an infection of the lung tissue itself. Now remember, when we're looking at individual medical terms and we're trying to figure out what they mean, we start with the suffix. So the suffix is going to tell you what kind of word are we talking about. So diagnostic suffixes include the meter, which is an instrument used to measure something, and metry, which is the act of measuring. Surgical suffixes include centesis, which is a surgical procedure that involves puncturing a body cavity with a hollow needle in order to remove fluid. Ectomy, which is the removal of something. And stomy, which is the creation of an artificial opening. Some disease and disorder suffixes are ectasis, which is the dilation or distension of a hollow organ. Emia, which is a substance that's present in the blood. Ragia, which is bleeding, excessive bleeding. And stenosis, which means a narrowing. There are a lot of procedures in medicine today that use scopes to look inside the body. It makes it much easier for us to see what's happening inside the body without having to cut it open in a large open incision. So some of the suffixes that we'll see with endoscopy procedures are the scope, which is the instrument used to examine the whatever body part you're looking at. Scopy, which is the visual exam procedure, so the actual doing of, like using the scope to look. And then scopic is pertaining to the visual exam, so that you might say it's an endoscopic surgery. So we know that they're using an endoscope to visually see something within the body. Here we've got diagnostic terms that we are building from word parts, and we can look at the instrument, the procedure, and then how that term can be descriptive. So I recommend that you pause now and see if you can figure these out, and then you can press play again and see if you are correct, because I'm going to give you the answers. So if we see the instrument as the endoscope, the procedure is endoscopy, and descriptively, it would be used as endoscopic. A bronchoscope performs bronchoscopy, and it would be bronchoscopic. A laryngoscope performs laryngoscopy, and it would be laryngoscopic. A mediastinoscope or laryngoscope can also perform a mediastinoscopy and be mediastinoscopic. That is a mouthful. And a thoracoscope, the procedure is a thoracoscopy, and descriptively it would be thoracoscopic. When performing a physical exam, we use auscultation and percussion as part of our sort of toolbox in figuring out what is happening with the patient. So auscultation means listening with a stethoscope, and percussion is tapping. So you typically put 2 fingers over the top of the patient's chest and then tap on those 2 fingers with 2 fingers from your other hand. When you're percussing the lung fields, they should be resonant. They should sound empty. But if you are doing that and it sounds dull, like not resonant, that could be with pneumonia because there's full of fluid. It can be a pleural effusion, which is again where there's fluid entering the lungs, or it could be a lung tumor. Abnormal lung sounds happen with multiple different respiratory diseases. So pneumonia again, COPD, emphysema, what else? Asthma, bronchitis. There are lots of different things that can create lung sounds that are not, you should just hear a very gentle movement of air with inhalation and expiration. Some of the names for the abnormal lung sounds that you can hear with a stethoscope are crackles or rails, rhonchi, stridor, and wheezes. And if you were to Google any of those, you would be able to hear those sounds. YouTube have some great videos where you can look those up and listen to them to see what they sound like. Two of the abbreviations you'll see this week are ABG and VBG. ABG is an arterial blood gas where they remove blood directly from an artery and look at the amount of oxygen and carbon dioxide in the blood. Blood is typically drawn, like when you do a blood draw, it's drawn from a vein. So taking it from an artery is different. Arterial blood is going to have more oxygen in it than venous blood. So a VBG, a venous blood gas, can also be performed, but it doesn't give you quite the amount of information that an ABG will give you. ABGs are typically taken out of the posterior side of the wrist, and I've had it done, and they are very painful. It's a very painful blood draw with a rather large needle. However, it does give very important information. So know the difference between ABG, arterial blood gas, and VBG, venous blood gas. The nice thing about the VBG is you can draw it out of an IV line if your patient is in the hospital and already has an IV in. However, if they're very concerned about what your oxygen levels are in your blood, they're more likely to perform an ABG. So hopefully that taught you a little something about the respiratory system, and I will see you back next time.